Hello, Louisa Jewell here. We at the Canadian Positive Psychology Association launched the first Canadian Workplace Wellbeing Awards in 2021 to seek out companies who were committed to the health and happiness of their employees. And we wanted to learn from these companies. Now, if the awards is new to you, you can learn more by going to cppa.ca/CWWA 2024. Now in its third year, I am thrilled to say that we had 10 winning organizations across Canada in 2023. I have the great honor and privilege to interview our winners to learn more about how they improve well-being in the workplace, including strategies, tools, and tips. Today, I am interviewing Leora Hornstein, who is the well-being specialist for Cenovus Energy. Cenovus won in the large company category this year. Cenovus is a Canadian-based integrated energy company headquartered in Calgary. They're committed to maximizing value by sustainably developing their assets in a safe, innovative manner, integrating environmental, social, and governance considerations into their business. They operate in Canada, the United States, and the Asia Pacific region. Listen in as Leora shares her strategies for promoting workplace well-being at Cenovus. Hello and welcome to Leora Hornstein from Cenovus.
Hello, such a pleasure to be here. Thank you, Louisa.
Leora, thank you so much for being here. I just want to congratulate you again on this wonderful achievement of the Canadian Workplace Wellbeing Award in the large private public sector category. And it really is well-deserved because Cenovus has been doing a lot of things around wellness for many years. One of the things that really stood out for me in your application, Leora, was the feeling that your organization wanted to embed this into the culture of the organization. So while some companies might be doing programs or initiatives, which of course is part of your program as well, your company really thought at a much higher level, how does this get embedded into the culture? So can you share with us some of your strategies? What did you do to approach changing the culture?
Yeah, thank you so much. And of course, that's something I'm immensely proud of too, and continue to build upon because it is a journey. And what's really, really neat is over the years to see the transition of health and wellness and well-being. What started as more of a programmatic approach over the years that some companies have taken, we are now seeing in the research that approach is perhaps not as effective as we had hoped that it was going to be. And so now we are seeing the need for companies to approach this as more than just a program and to really work to transition the health of the organization and the way by which we are working and the design of work and the systems and ultimately the culture to build upon a culture of well-being that not only provides the right supports, programs, benefits, should people find the need to make use of those, but to really start looking downstream and start preventing issues before they occur. And for us, and for myself as a practitioner in this space, it's really about how do we continue to build healthy ways of working for our people and this, overarching culture of well-being at Cenovus.
Well, and I think that's such a smart approach because it really doesn't matter if you're implementing programs or workshops or initiatives if people are just then going back to a culture that doesn't support well-being. So it seems logical that you would start with the culture. And I like, not a lot of companies also have an eye on prevention. So to understand, that the psychosocial hazards include things like, managing workload and, leadership styles. And so there's so many things that can affect somebody's experience at work, whether it's a well-being experience or whether it's an experience that's preventing them from experiencing those high levels of well-being.
Exactly. And that's why um, it is such a journey, and any culture work is a journey, and there's so many opportunities, which makes it so exciting. And for us at Cenovus, safety is our number one top priority. And so it's helping to expand what that definition of safety is, and to help really work collaboratively with our occupational health and safety teams and our HR teams to really think about that holistic definition of safety, not just physical safety, which is that more traditional view of safety, but to also include the psychosocial aspects of safety, which of course we know has a great and substantial impact on how people are able to show up and do their job safely and properly, and especially in our environment, because for many of our workers, they are working in high risk, hazardous roles. And so, for that reason, it's even more important that we are very thoughtful about all aspects of safety.
So, how did you get leadership buy-in at those very high levels? And how do you maintain leadership accountability for well-being? Because it's one thing to put out a policy or to say we're going to do this. It's another thing for leaders to actually follow through and live in a way and manage in a way every day,
Yeah,
continually to promote
yeah,
well-being.
yeah, absolutely. And that is, as I say, it's part of hmm, the opportunity and excitement of this role and this work is, something that's really important for me is how do we make this space and the scope of work matter to our leaders? How do we speak in a way that makes sense to them? So we're not just coming at them with this kind of fluffy well-being talk, for less than a better way of saying that, but that we're really speaking to them with a language that makes sense to them, right? And really getting at those that parts of the business and running our business and connecting this to our business strategy in a way that, of course, for to have any kind of behavior change, especially for our leaders, it has to really appeal to what's important to them and their values and our values as an organization. And like I say, that core value of safety as our number one priority, that is a way that we keep this conversation alive and top of mind. And just having that continuing conversation. Then the other part of that is actually having the data and the metrics that shows and connects what we are doing, why we are doing it, and here are the results of what we are doing, so that you can come at this, number one, very strategically. That's how you keep leaders involved, interested, and understanding from their purview. Um, and then also, just keeping them, the other part I was going to say is being very collaborative in our approach. So finding all the stakeholders and keeping this work embedded. So, for example, our leadership development team, we've actually now embedded mental health training for leaders right into our leadership development program. So it's integrated, it's connected, and it's right in there. So instead of seeing, various well-being initiatives or programs that maybe feel a bit more isolated, we're doing all that we can to keep this work really integrated, collaborative, and strategic, so that we can, we have our goals, our objectives, and then we also have the data to show our success.
And so what kind of data have you accumulated then? What have been some of the benefits of implementing these programs and initiatives and a change in the culture?
Yeah, and Louisa, this is really exciting work that myself and our teams are doing as we speak. It was something we started on that journey in a much more rigorous way last year because we'd been doing all this incredible work for years. And while we do have, data points, we didn't have it all collected in the best way to tell the best story possible. And so we're really on this journey now to think about what data do we want to collect to tell the right story, and how do we package it together to make the most sense of the numbers? And also, as I said before, how is that data actually showing and giving a certain level of backing to what we're doing. So, right now we are concentrating on both leading data and the lagging data. So, our traditional, disability management, benefits usage, claims data as well. Of course, that's very important when you look at all of that. But then also on the leading front, looking at things like vacation time utilization, hoping to get some data around emails sent after hours, looking at just kind of workforce data and what are we hearing, exit interview data. But perhaps what I'm most proud of is we had an organizational health survey done in 2022. It's something that we do every couple of years at our organization with some pulse surveys done in between. And for the first time, we were able to incorporate some well-being questions in that spoke to the benefits of what we were doing. So that was really exciting data that we were able to capture, and we'll have that going forward to have and compare.
I thought I had one of the results, 81% favorability score for CVE provides health and wellness programs, resources, and support, which is
Yes.
outstanding. Yes.
Yes, thank you. And something to absolutely for our organization to feel very proud of, because what that shows is, what we do have full control over in this work and in the scope of work is thinking about, being very intentional to match our programs, our resources, our offerings, of which we have so many, to actually meet people where they're at, right? What are people telling us? What do people need? What is going on for them in that moment that we can help and provide support? So we, we have a lot of offerings at Cenovus, and probably jumping ahead, you can tell how excited I am, but we really are very intentional about making sure that what we put out there for our people is going to be of maximum benefit to help and support and provide skills and provide them some control over what matters most to them.
And I think too, it's important that they know about it because you could do all these wonderful things if your people are not aware of it. And I think that's the other side of the coin, isn't it? You're getting leadership involved, you're trying to change culture, you're doing all these programs and initiatives that are all integrated in the strategy. And then what are you doing to inform your employees so that they're aware of it all? And it seems like everyone at your organization or large percentage knows, yes, we know about it, we're aware of it, and we're giving you a good rating on that as well. So
Yeah.
that's good feedback. That you do often get feedback. How often what kind of surveys are you doing? How do you get this kind of regular feedback from your employees?
Yeah, so I would say it's a mix. Our organizational health surveys, our pulse surveys, which we are hoping to have another one going out in early to spring of 2024. That is kind of more formal feedback that we are looking at. We also look at data around our intranet utilization and our readership of what matters to people. What are we putting out there to communicate? What is happening? Are people looking at that? We send out surveys with every wellness session or event or workshop that we put on. We send out surveys through that method. And really, the other part of that is just listening for us to listen to what are our leaders telling us, what are our HR business partners hearing, what are people feeling, what's the sense in the organization. We do collect exit data or exits data as well. So we get to, have a picture there. So it is a mix in this space. I would say it's a mix of a number of ways of hearing, sensing, seeing, and then, as I mentioned, all the data that we're seeing from our, claims, psychological health usage, EFAP utilization. What are we hearing on that end too? So our approach really is very integrated. You spoke about that way of, communicating and getting it in there, getting it out there, because we have such a large and geographically dispersed population. It's really thinking through what makes sense and how do we communicate and get this message across. If we think about one of our field workers in northern Alberta versus somebody else in an office in a remote location, it's very different. So it is about, getting um, putting out, making, I want to say a lot, but we are very strategic too in what we offer. But we are about, what do we see? What do we hear? What is the data telling us? And how do we match what initiatives, what support we're putting out there to have it make sense for our people?
Yeah, it's very data driven. Excellent. So in 2019, you increased your commitment to well-being with the creation of the Experience and Engagement Team. So can you tell us more? What does your Experience and Engagement Team do, and how do they do it?
Yes, happy to. And also, I should say that since 2019, just like all organizations, we've had a number of structure changes. So that team per se is not in effect. It is it's had some tweaks, and I don't actually sit within that team anymore. But what I can say is I work very, very closely with well-being. The interesting thing about well-being, Louisa, is structurally within an organization, it doesn't necessarily matter where you fall or where you sit. It's about finding those right stakeholders and forming the right relationships, because the truth is well-being lives everywhere and in every part, with every person, every leader, every team in the organization. So for any practitioners in the space, I would encourage, wherever you sit, don't let kind of structural boundaries of the organization impact how you deliver on this work, because this work depends on it getting everywhere. And so, to answer that question, I now sit within a total rewards, benefits, disability management team, and I still work very, very closely with our culture, diversity and inclusion, employee experience team, because that is how we continue to shape, transform, shift our culture. So as I had said, this work is so very integrated. And so, the benefits and programs and total reward space is really important to make sure that we have that foundation, we have the right supports, we have the right um, resources and structures there for when people need it. And the other part is making sure that we integrate this work right into the culture, if that makes sense.
Yeah. Now, you also have mental health ambassadors at the community level. Is that right? Can you tell us more? What is a well-being ambassador? How does that work?
Yeah, so this is really cool. So in 2018, we partnered with the Canadian Mental Health Association and brought in the Not Myself Today program to our organization. And as part of that program, there's kind of three levels. The first is our general employee population. The second is kind of myself, considered the campaign leader. And the third population is ambassadors. And those are people that are interested in championing this work and the program out to the organization. So for this number of years, for the past 5 years, we've had a group of very committed program ambassadors that are also not just championing the program, but championing well-being and our, resources, events, the conversation. They're really the group that brings this information down to the local level, to their teams and their leaders. And they act as a conduit back to myself and the team to let us know, what are we hearing, what are we seeing, what is meaningful. And so on top of that, which is something that we've worked really hard to cultivate, and they're just an incredible group of ambassadors. We have just launched a formal employee resource group for mental health just last month, which is incredibly exciting. And so this is more of a formalized structure. It will follow the structure of we have a number of employee resource groups at Cenovus. It has, some governance. It has executive sponsorship. And so our ambassadors will now have even more power behind them and support as they work with our employee resource group to continue to bring this support and this information down to the local level, and provide that work to help reduce stigma, work to bring support and that feeling of community for our people.
So these ambassadors then it's not their full-time job, is it? They have a job. They're just kind of expanding their role to act as an ambassador for people who want to. So they volunteer to come into that.
Exactly correct. And so, I mean, that's what makes it even more special is that these people are doing this from their hearts. They believe in the work, they believe in, many of them have personal lived experience that they just want to help and serve and make things better. So it is, absolutely when ambassadors, are onboarded, I work to be sure that they have leader support and buy-in and commitment, because it is a development opportunity for them, and also because they're going to be working with their leaders to help to shape the culture of their teams. But it is voluntary and it is in addition to work that they are already doing. So
Which I
even
think is,
more, right, even more powerful the work, what they're doing is.
yeah, I agree. And that's how we've always found success in organizations is you find those people who are really passionate about it, regardless of where they are. Now, uh, for us at the Canadian Workplace Wellbeing Awards at the Canadian Positive Psychology Association, we're looking for organizations that have implemented positive psychology based programs. So, why was that important for Cenovus?
Yeah. And so this is something I'm so hugely passionate about, Louisa, because positive psychology, has so much potential to impact individuals in the most positive way. So while, yes, we have challenges, life is full of challenges and difficulties, and you just need to open the news to see all of that. Positive psychology is really based in principles that we get to choose we get to choose how we respond to what's happening that's beyond our control. We get to actually make the choice to see things in a different way and to impact our mindset, to impact the way that we show up. And with that, how we show up then has the ability to influence and make things better for others, whether it's at an organization level, so within teams and organizations. But for me, it's that ability to impact our society and our communities in the most positive way. So that's why positive psychology resonates so strongly with me. It's, how do we, with what's going on that's outside of our control, how do we make the best and right choices for ourselves?
Love that. Well, thank you. Thank you so much for being here. Thank you so much for sharing this incredible knowledge with us in our community and Canadian workplaces. And thank you for all the work you're doing to promote well-being, because I am, as the president of the Canadian Positive Psychology Association, I am inspired to see that there are companies like yourselves at Cenovus that make well-being for their employees a top priority. And you've proven it with everything that you've done. You're not just paying lip service. You are truly, truly an exemplary. You are a great example to all of us of what we can strive to be. So thank you,
Mm.
Leora.
Well, thank you so much, Louisa, and thank you so much to the Canadian Positive Psychology Association for all that you're doing, for all you're doing to inspire people like myself to want to continue to do this work and really, at its basis, to just make our world better for everyone in it. So thank you so much.
Thank you. All right. Have a great day.
You too. Take good care.